Welcome. My name is Holly Ahrens. I'm the Clinical Program Manager at HealthPoint at Dakota State University. We are South Dakota's Regional Extension Center, and we're bringing you a webinar today of breach notification and some omnibus rule changes for you. Do a little background in terms of where breach notification originates, and it is in the Health Insurance Portability and Accountability Act, which is HIPAA of 1996. Two rules that we focus on mainly are the privacy rules and security rules. And since that time, we've had the American Recovery and Reinvestment Act era of 2009, and part of that was the HITECH Act, which is Health Information Technology for Economic and Clinical Health. Within HITECH Act, there was a final rule about breach notification for unsecured PHI. This was effective September 23rd of 2009. And recently we've had some HIPAA omnibus rules, and those rules came out in effective March of 2013, and our compliance, we needed to be compliant, was the 23rd of September in 2013. So really important dates or important things that were happening in terms of regulation and affecting health information technology and the security of protected health information. Some dates that you should be aware of in terms of compliance and effectiveness. The rules are located in 45 CFR. These are the HIPAA rules of Section 164 from 400, the standard 400 to 414. This requires that covered entities that are covered by the HIPAA rules must notify individuals when a breach occurs. It does identify that all breaches are reportable, and we're going to talk about how we determine reporting and which ones will be reported. But it is presumed that all breaches are reportable, and covered entities are required to perform and document a risk assessment of these potential breaches. So what is a breach? Let's make sure we understand that. A breach is generally an impermissible use or disclosure under the privacy rule that compromises the security or privacy of protected health information, or PHI. Now, an impermissible use or disclosure is presumed, and there's this presumption of breach, unless the covered entity or business associate, as applicable, demonstrates that there's low probability that the PHI has been compromised, and that is based on a risk assessment. We're going to talk about that. But there are some exceptions to this definition, and there's three of them. And you should know these quite well, because we're going to go through a decision tree, and knowing what these are is very important in terms of taking next steps. So one is any unintentional acquisition, access, or use of PHI by a staff member or a person acting under your authority, such as a business association. And if such acquisition, access, or use was made in good faith and within the scope of authority, and it doesn't result in further use or disclosure in manners that aren't permitted under the privacy rules, this would be an exception. Number two is any inadvertent disclosure by a person who's authorized to access that PHI at the covered entity or the business associate to another person authorized to access PHI at the same covered entity or business associate organization, or organized healthcare arrangement in which the covered entity participates in the information received as a result of such disclosure isn't further used or disclosed in a manner not permitted under the privacy rule. Okay. Now, number three is a disclosure of PHI where a covered entity or business associate has a good faith belief that the recipient or that unauthorized person to whom the disclosure was made would not reasonably be able to retain that information. So those are our three exceptions to the definition. Well, let's take a little test, see if we were able to absorb that information about exceptions. So first one, oops, I accidentally hit send to our billing person, and this is a contracted person, and it was a claim that I sent that we had been talking about, but I sent the wrong person's claim. Now, it had the patient's name, the date of birth, the insurance ID, Social Security, date of service, diagnosis, procedure codes, everything that's on a claim. Is this a breach? No, this would be considered one of the exceptions. It was the inadvertent disclosure. All right, next one. Oh, I'm looking at my day. I've got quite a few patients today. My first one is Mr. John Smith. I open his chart, begin to view and review for our treatment session, and this is a 56-year-old Caucasian male. And I review his chart, and I'm prepared. And when Mr. Smith arrives, he appears to be a 23-year-old Native American man. Obviously, I've reviewed the wrong chart. Was this a breach? No, this was unintentional access. You didn't have enough information to tell you which John Smith it was, and you selected probably the first John Smith that came up, and this was unintentional. You are part of the covered entity, and you did not mean to do this. All right. Next, Hank, our local computer repair guy, came to our office. He's offering new computer repair services. Thank heavens. I've been frustrated all day with this computer. I had him come around, sit at my computer, because I couldn't get that thing to unfreeze. He was having problems too, so he said he's going to take it to my office. He'll have it back this afternoon. I gave him my login information so he could get in, and I just took his card. He said he'd invoice us, and if we liked the way he does work, that he'd be willing to enter into a contract for ongoing services. Is this a breach? Potentially, yes, this is a breach. You've given this person who you don't have a contract with access to your laptop, whereas on that laptop there may be PHI. So this would definitely be an incident. Whether it was a breach, we would have to do some investigation. All right, so I wanted to offer you one of the tools that I think is done very well, and it was part of a journal article from the American Health Information Management Association, and the title was Performing a Breach Risk Assessment, and this was in September 2013. It was very, very well done, and the citation is there if you would like to pull that entire article up. But this decision tree is really a great tool to have within your policies and procedures. This would afford that person who is responsible for incident management, HIPAA compliance, those types of things, to have this as a resource and a tool available to move through the process and making sure that all steps are done. So let's talk about how we make these decisions on how we're going to do notification of a breach. Your first decision your first step here is really about incident management and how you're reporting those type of things. We're going to talk about that in a little bit. But so there's an incident and someone reports it and it has a potential violation. So the first question that you ask is, has a HIPAA violation occurred? And state rules may apply as well. I think one of the things, or actually two of the things I want you to be aware of is that you need to have someone who has knowledge of HIPAA security rules. This is not something that you can just throw on someone's desk and say, okay, determine if this was a breach or not. So making sure, and we're going to talk about responsibilities and assignment in the next few slides, but this is your first question. Has there been a violation? So obviously you need someone who knows HIPAA rules. If no, then you just document and close this incident through your usual incident management processes. Now, if there is a violation, it is presumed to be a breach. But let's just look at, in HIPAA, there is a requirement in the regulations for you to assign someone responsibility to be someone who governs over these HIPAA privacy rules, policies and procedures, the processes to make sure that you're compliant. And this could be many number of names: HIPAA compliance officer, HIPAA privacy officer, security officer, risk manager, but someone needs to be identified. And this would probably be that person who has working knowledge of HIPAA rules or that you're going to train up. I talked about this incident management process. This is something that I think that all of us should already have, and if we don't, we need to put this on our to-do list, that you need to have a way to identify, contain, repair, and prevent incidents within your organization. It should outline a very formal reporting process that all staff could be notified how and when they're supposed to report incidents. There's a tracking mechanism, investigation requirements, and documentation requirements as well. So once again, if you don't have this in your office, making sure that someone is developing an incident management process, because it is the way that the first step in this breach notification decision tree. All right, so as we move forward in our decision tree, the question now we ask is this an exception? And we've gone through those exceptions. They are there on the left. So if it does meet the exceptions, yes, this is a violation of HIPAA rules, but it wasn't a breach. So you just document and close this incident. Now, the no, this does not meet any of the exceptions. That means that we need to move further. And the next step, or the question that we ask, was this protected health information secured? Okay, we're going to talk about this in detail of how you secure PHI. Let's talk about mitigating the risks, and a way to do that is encryption. So protected health information needs to be rendered per HIPAA regulation unusable, unreadable, or indecipherable to authorized individuals if one or more of the following applies: that there is data at rest or data in motion. So how do we secure the data? Making sure that within storage, transmission, and disposal, you should have policies that address how you're securing that data in each one of these formats. PHI will be encrypted through an algorithm, and it's a requirement of HIPAA that this algorithm to be used. And I'm going to detail this process, and it is somewhat technical, and I apologize to anyone who this may just soar over your heads, and it does me at sometimes too. So if you can just follow through, and I think you'll understand it's not that technical of a process in terms of concept, and it is very much so that you're putting data into a format that's scrambled, and you're giving keys to people who would be able to unlock or decrypt this information. So for data transmitted over, and this is an example, for the Health Information Exchange, this is how they encrypt their data in transit, because that type of setup to exchange information is all about data in transit. So for data transmitted over their NovaGrid, the system encrypts all payloads at data level using 2048-bit symmetric encryption streamed over 128-bit encrypted SSL. When the agent is authenticated to the grid, so getting someone authorized to use the grid, the system generates a public key pair, okay? So that PKI key pair. The agent keeps the private key, okay, but distributes the public key to other agents on the grid. So when an agent needs to send a message to one or more other agents on the grid, it encrypts the message with a random 2048-bit AES encryption key. The AES key is then encrypted with the public key of each of the destination agents. Okay, that after receiving the message, the receiving agent is going to use that private key to unlock the AES key, and then use the AES key to decrypt and process the message or the payload. Okay, so that, to me, that makes sense, that you're making keys per se that will lock and unlock things, and I think we can all adhere to that type of concept, although it is very technical. But that's just an example of encryption of data in motion. So back to our decision tree. The last time that we looked at it, we were asking the question, is PHI secured? And if it was yes, the incident wasn't a breach, and no notification for HIPAA breach was required. We're just going to document and probably do a corrective action plan because there was a violation and it didn't meet the exceptions. So now we're at no. Potential for compromise, this is a big thing here. Risk analysis is going to be required. Okay, so we move along our steps. So this risk assessment or risk analysis of the incident is so important, because when you're thinking about that presumption that there is risk, and the way that you can decrease the presumption is to identify if there's probability of risk, then you need to do this assessment. And there's 4 things that we need to look at, and we're going to go into those. But really we're asking the question, is it determined to have a low probability of compromise? And if no, we're going to do, we'll move along that step in a minute. But if there is a low probability, you don't have to notify HHS or the patient, but document the incident, and a correction active plan probably is required because we've gotten this far down and there is some type of violation that was done, but you did have some security measures in place that put the probability up to, or kept it at a low probability of compromise. So, kudos to you if you've gotten into that window. But we're going to look at this no and doing this breach risk assessment. So a breach has occurred, it's reportable unless, we can demonstrate this low probability. And the factors that you're going to look at are nature and extent of the protected health information that was involved, including the identifiers, likelihood of re-identification, the unauthorized person, who was it, what type of person, where do they work, that type of thing. And then was it accessed or viewed, and what was the extent of the mitigation that you had put in place. So these are the factors you're looking at. The elements of breach notification, this is a formal process, and it should be in your policies as a formal process. So there's someone responsible, there's documentation requirements, there are assessment guidelines, there's decision trees, there's processes, and all of that is outlined in your policy. So when we're looking at nature and extent, trying to determine it, we really want to know what type of data was it. Is it sensitive? Was it mental health information? Was it cancer information? Was there identifiers in it? Is re-identification possible? What was the amount of PHI? Really the goal here is determine probability of use. So here's a list of questions that you could use in determining nature and extent of the information. So what patient identifiers were used or disclosed? Does that combination increase the risk? Was there particular identifiers like Social Security numbers? Does the PHI contain sensitive, like we had said? Does the amount increase the risk? And I think this is one thing that we want to make sure that we're looking at that I think a lot of people leave off, is that amount of information. And when you're doing this, in terms of thinking about what the goal is, you want to make sure that the probability that that PHI could be used by an unauthorized person in some adverse way, making sure that that is the goal and not trying to protect yourself. Be very honest and objective about this and making sure that you have all the information. And as we move through this process, you are going to be rating these things and determining, and there's a risk factor then. There's a whole formula on this, and there is a tool that you can be able to do that. And there is different tools out there. Legal counsel has tools that you can use. I know AHIMA has tools available. But it is a scoring risk factor. So you're looking at type of information, and as the information is more sensitive, the risk factor goes up. So if it was a zip code only, obviously this would be a low risk factor. As we move to a Social Security and a name and a date of birth, this becomes a higher risk factor. How was it disclosed? Verbal, paper, or electronic? These all factor into the risk. Who was the recipient? Was it someone who was a hacker? Was it someone who works in healthcare, who understands confidentiality? Was it a payer? Those types of things. How was it released? Was it willful? Did someone steal it? The disposition, was it redisclosed or was it sent back to us? What controls did we have in place? Was the laptop encrypted? Were we able to wipe the data remotely? Or was there no controls, which then obviously increases the risk. So This is only a guide, but ensuring that you're documenting all of this work in the investigation and assessment is very important in terms of making sure you're validating your actions. All right, so our last step that we had looked in the process was that we had answered no, that there was a high probability. So there was no low probability, that we've done our assessment and we have found that there was a high probability that this was accessed and potentially redisclosed, and it is truly a breach. So the next question we ask is the breach affect more than 500 individuals? If no, then you only need to report this on an annual basis, and this patient and you do need to notify the patients within 60 days. If there's a timeline in your state that's less, then obviously you have to follow that, whichever is more restrictive, but within 60 days, a notification to the patient. Now, if it was more than 500 individuals, then yes, the Office for Civil Rights needs notification required within 60 days, and then also the patient notification within 60 days. So let's talk about breach notification requirements. You need to notify an individual, media notification, secretary notification, and also there's notification by your business associate. So notification to an individual, let's start there. You need to provide notice in written form by first-class mail or email if they agree to such notices electronically in your previous dealings with them. If you don't have current data for 10 or more individuals, you need to supply substitute notice. This could be on your home page of your website, and you have to leave it up for at least 90 days, or in some major print, which would be newspapers or broadcast media, where those affected individuals likely reside. The elements that you must have within that notice is a toll-free number that's active for at least 90 days. The notice has to be no later than 60 days following the discovery. There needs to be a brief description of the breach that had occurred, describe the type of information that was contained in the breach, what steps they need to take to protect themselves from potential harm, a description of what the covered entity is doing to investigate, mitigate, and prevent this type of breach happening again, and then also contact information. Now, for media notification, covered entities that have that breach more than 500 individuals of a state or jurisdiction are, in addition to notifying individuals, they must notify the media. And these are prominent media outlets serving that state or jurisdiction where these 500 residents do live. Now, covered entities will likely provide this notification in the form of a press release, is usually to the appropriate area. And like the individual notice, this immediate notification must be provided without unreasonable delay in no case later than 60 days following the discovery of the breach, and must include the same information required for the individual notice. So those same elements that we ticked off previously must be given to media as well. All right, next is notification to the Secretary of Health and Human Services. In addition to notifying affected individuals in the media, covered entities must notify the Secretary of breaches of unsecured PHI. They can visit the HHS website, which is at hhs.gov/OCR, and you can find it from there. You fill out the electronic form. It's a breach report form. If it affects 500 or more individuals, the covered entities must notify the Secretary without unreasonable delay in no case later than 60 days following a breach. If it affects fewer than 500 individuals, the covered entity may notify the Secretary of such breaches on an annual basis. Reports affecting fewer than 500 are due to the Secretary no later than 60 days after the end of the calendar year in which the breaches are discovered, and that's where that annual basis comes from. All right, so that notification by a business associate is also required. So if the breach of unsecured PHI occurs at or by a business associate, the business associate must notify the covered entity following the discovery of the breach. A business associate must provide notice to the covered entity, again, without unreasonable delay, no later than 60 days from the discovery of the breach. To the extent possible, the business associate should provide the covered entity with the identification of each individual affected by the breach, as well as any other available information required to be provided by the covered entity in its notification to affected individuals. So all those elements that are required for notification to the individual, you can get those from the business associate, and they're required to give that to you. The burden of proof. Well, the burden of proof falls on covered entities and business associates, and they have the burden of demonstrating all the required notifications have been provided, or that a use or disclosure of unsecured PHI did not constitute a breach. So it's all on you to have the right documentation of what was done. So with respect to an impermissible use or disclosure, the covered entity or the business associate should maintain documentation that all required notifications were made, or alternatively, documentation to demonstrate that notification was not required. So it's risk assessment demonstrating a low probability that the PHI has been compromised, or the application of any other exceptions to the definition of a breach. So if you did determine that your incident was part of the exception, make sure you document that's what you came to that conclusion. So I wanted to give you an insight into, let's say you had to notify the secretary. There is an extensive amount of information that you need to collect to do that notification of the breach report form. So I wanted you to know that, so when you are building your policies or process or procedure manuals or forms, you know what type of information you're going to have to collect. You're going to have contact information for the covered entity, and if it's a business associate as well, the breach start and end date, the discovery start and end date, the approximate number of affected individuals, what type of breach was it? Was it a theft, loss, improper disposal, hacking incident? What location? Was it on a laptop, a portable device, electronic medical record? What type of information was included? Was it demographic information, financial, clinical? What safeguards did you have in place? Were there firewalls, intrusion detection, encrypted wireless, antivirus? All of that information is required for your notification. So make sure that you're building that into your process. And then the last thing is, when you get done with that form, you need to attest to all of that information. So I would assign this responsibility to someone who can actually attest to this type of attestation. And I'm going to read it to you because I think it's important that people understand this type of attestation. So under the Freedom of Information Act and HHS regulations at 45 CFR Part 5, OCR may be required to release information provided in your breach notification for breaches affecting more than 500 individuals. Some of the information provided on this form will be made publicly available by posting on HHS website pursuant to 13402E4 of the HITECH Act. Additionally, OCR will use this information pursuant to 13402 of the HITECH Act to provide an annual report to Congress regarding the number and nature of breaches that are reported each year and the actions taken to respond to each breaches. So your information will be made public on the HHS website, and also this information will go to Congress to show where these breaches are happening and what is being done in response to these breaches. So this type of information, like I said, you want to ensure that someone who is responsible, that you trust, would be able to complete this notification, because this is going to be public information. Well, we don't want to get to that point where we are in the notification and attestation of a breach. So how do we prevent? Prevention really is is how we want to go about this in creating a culture of compliance. You need to have policies and procedures in place, and specifically, access control, password management, ensuring that, remote access, mobile devices, you need to have encryption policies and procedures, somebody who's responsible for that, and making sure all devices are encrypted. Doing a asset inventory, knowing where your protected health information is stored and created, and making sure you're mitigating as many risks as you can down to the lowest probability. Business associate agreements, so important to ensure that you know what your business associates are doing to protect the information that you're giving them to do the work for you. Again, risk assessment, I can't state this enough, that this really is the backbone of your compliance program, to have a risk assessment done and ensuring that you know where the gaps are so you can begin to mitigate them. As I said, creating that culture of compliance, really showing your patients that you value their information, that you're protecting it. So just to wrap up, incident management and someone that is identified to, someone who's knowledgeable, that's identified to be responsible for these tasks, assessing that probability and mitigating to the lowest possible probability is so important, and it is the determining factor of whether you have to do a notification, and understanding what that notification process is, that there are data elements that you want to make sure you collect at the time of investigation, and having a knowledgeable person to make that attestation that that they know that information will be made public is very important. Well, I thank you for attending. If you require any further assistance, please let us know. This information will be available on our website. Have a great day.